Hi there, I'm Krista. I'm one of the registered massage therapists at BodyTx, Massage, Acupuncture, and Health. And today I'd like to talk to you about fascia. Some of you might be wondering, what is fascia? Fascia is a connective tissue found throughout the entire body, from the tops of our heads down to the tips of our toes. It covers our bones, our muscles, our arteries, our veins, our nerves, our internal organs. It's everywhere. But today I'd like to talk to you specifically about how it affects our muscles and how it affects our posture. So fascia can actually, or is actually separating, positioning, and indirectly affecting all of our muscles. So there are two types of fascia I'd like to be talking to you today. And the first one is superficial fascia. So this fascia is actually a thin, silk-like sheath that covers all muscles. So it's very similar to the silver skin that you would find on chicken or any other meat at your local grocery store. The other type of fascia that I'd like to talk to you today about is the profundi fascia. And this fascia is a deep layer of fascia that is cord-like and sinew and throughout the entire body that our muscles, organs, arteries, veins hang off of and are affected. Even our bones are affected by this deep profundi fascia. And so some of you might be wondering, how does this fascia get damaged or affected that can cause me pain? So one of the ways that the fascia can be affected or damaged is through a direct injury. So we've either injured the muscle, we've injured a bone, an artery, a vein, a nerve, or even our internal organs. Another way that we can actually affect this fascia is through our posture. So sustained poor posture can actually affect the fascia and cause it to shorten or shrink. So when this fascia shortens or shrinks, especially the superficial fascia, it actually shrinks and squeezes and tightens on each individual muscle and can cause compartment syndrome, which then causes the muscle to go through an inflammatory process, which causes it to swell and heat up. And that can cause some acute discomfort in different areas of the body. Most people find that they have shin splints or problems with their calves, and that's typically where we find most of the compartment syndromes, but they can happen anywhere throughout the body. The other way that the fascia can affect the body is the deep profundi fascia is actually connected to our bony structures, which can then, once they start to shorten, can cause our bones to misalign and not be in their proper position. So we may have a shoulder that's elevated, we may have one that's down, our shoulders may actually be rounded forward, we could have a slight hip torsion, our knees could be out, our hips could be out. Really, it can affect every single part of our body, and that is where we start to get those chronic aches and pains that never seem to go away. And so today I'd like to talk to you a little bit more about how we can fix this. So some things that we can do are going for massage, going for acupuncture. So during our treatments, we're able to actually help open up these fascial lines and open up this fascia so the muscles are able to do what they're supposed to do, but it doesn't stop there. What we do at the end of our treatment is give you some home care. And that's the biggest thing, is if you go home and you do your home care every day, then you will actually start to feel much better and your aches and pains will become less. And you can talk to your acupuncturist or your massage therapist about your treatment goals and what you want to get out of coming to the clinic. We are not a quick one-time fix clinic. We want to be able to help you get better faster and longer. So book an appointment with us today and we can talk more about your fascial lines and how they can affect your body. Thank you so much.